Hi guys, welcome back to my YouTube channel. If this is your first time, my name is Blessing and you're welcome to my page. You're going to love it here. On today's episode, I'm going to be talking about how to have safe sex if you don't want to get pregnant. This safe period are the period when you can have unprotected intercourse and you will not get pregnant. Why fertile days are days where you have unprotected intercourse and you will conceive or you get pregnant. So in order for you to understand what your safe periods are and your fertile period, you should first be able to understand your menstrual cycle, because this goes hand in hand with each other. This is what we are going to be talking about today. Average women have 28 days cycle, while others are lesser or more than that. So whichever one it is, you should first understand what your menstrual cycle is. There are several factors that is regulating the menstrual cycle, which hormone is one of the vital of them, and that is what I'll be talking about today. So that hormone which is very important is the luteinizing hormone. I'm going to be showing you your safe days, the fertile days, and how you'll be able to calculate if you don't even know your menstrual cycle. So if you don't know your menstrual cycle, the best thing which I will advise you to do is to get a calendar, and then whenever you see your period, that is the first day you see your period, you circle it on that calendar, then you keep it in a place you know you'll be able to find it next time, and you calculate this for 3 months at a go. That is, this month, let's say you see your menstruation on the 1st, you circle on the 1st, then next month if it is on the 1st again, you circle on the 1st, like that for like 3 months. So you'll be able to know your menstrual cycle, if it is a 28-day cycles or maybe like 27 or like 35-day cycles. Okay, so let's get into the video. The most important factor is the hormone, which is the one I'll be using to show you this calculation, just to make it easier for you. So what you need to do is to get yourself a calendar or like a play sheet, like I'm doing here. I'll be using a graph. This side is my LH, that is the luteinizing hormone, and on this side is going to be our menstrual cycle, which is one. Average women have the 28 days menstrual cycle, which is the one I'll be using here. So I will assume that first of that cycle is the first day you see your menses. On this day, let's assume that you have sex on this day, which is not ideal, but some people do it. Average people menstruate for like 4 days, while some other people can have like 5 or 6. So I will assume that your menstruation is for 4 days. So let's say you have sex on this first now, which is your first day of your cycle. Usually the sperm cell is motile, that is, it can stay in the body for like 5 days. Let's say someone have unprotected sexual intercourse on this day. So you calculate from here 1 2 3 4 5. The luteinizing hormone on this day is very low, 14th day. That is when it will get to its peak, on the 14th day, and then after the 14th day is going to fall down gradually again. So let's say you have sex on this first day. Now this is 1 2 3 4. It means you cannot get pregnant on this day. You can't get pregnant. So these days are your safe days. Let's assume you now want to have sex on the 6th or on the 7th, and you have 1 2 3 4 5. Here you can say that from this night of your menstrual cycle till this 14th, my dear, you're not safe. These days are your fertile period, and on this 14th day is when the ovum is going to release the egg. That is, the egg will be released on these 14 days. Mind you, some days it can delay up until 15th or 16th. So let's say someone have sex on the 9th, 1 2 3 4 5. This person is going to get pregnant. So these are your fertile period. That is, from the 1st to the 8th, it is safe for you to have unprotected sex. Safe. On this 14th day, that is when the egg is being released. Like I said, the egg is being released here, and on this 15th, 16th, it is most likely that some will be released on these days. So you know, if you now tend to have sex on this day, you might still get pregnant. That is why we are going to add 1, 2, 3, 4 to your fertile days, and then on the 19th day till the 28th day, you are in your safe period again. So if someone is trying to conceive or wants to get pregnant, these days, this on the 9th till the 18th, are the days that you should work and enjoy. These are the days for you to get pregnant. But if you don't want to get pregnant, you should avoid having unprotected sexual intercourse on these days. So just as you've seen the calculation, the egg cell can stay in the body for 24 hours. That is, after the egg is being released, it can stay in the woman body for like 24 hours. So yes, that is the calculation, and those are the safe and unsafe period. So in summary, the first day you see your menstruation, you're safe from that day till the 8th day, while from the 9th day till the 18th or the 19th day, you are not safe. You are in your fertile period, and in this period you can conceive. So in this period, if you want to get pregnant, that is the period you should have consistent unprotected intercourse. However, if you don't want to get pregnant, these are the days you should avoid being pregnant, or you should use other form of contraceptive. We've calculated it. You've known your safe period, you know your unsafe period. Mind you, this method is not 100% accurate, so it is advisable for you to have a backup, like another contraceptive plan, in order for you to have a perfect plan. So yes, if you have any question, you can drop it in the comment section, and I'll definitely respond to your comments or your questions. And thank you so much for watching the video. I'll see you in my next video. Don't forget to subscribe to my channel and give me a thumbs up if this video is useful for you. Thank you. Bye bye.